Stop pushing yourself to walk faster. Stop icing your swollen ankles every night. Stop accepting that cold, heavy, achy feeling in your legs as just part of getting older. Because everything you've been told about poor leg circulation after 60 is backwards. And in the next few minutes, I'm going to show you the one exercise that vascular researchers have quietly been studying for years, an exercise so simple, so overlooked, that most doctors never even mention it in a routine checkup. I'm a vascular surgeon. I've spent decades in operating rooms looking at legs from the inside arteries, veins, valves, the whole intricate plumbing system that keeps blood moving from your heart down to your toes and back up again. And here's something that should alarm you. Peripheral artery disease and chronic venous insufficiency together affect an estimated 1 in 5 adults over the age of 60, according to data compiled by vascular health researchers in North America. That's not a rare condition. That's your neighbor. That's possibly you. And the frustrating part is that most of what's recommended, compression socks, elevating your legs, cutting salt, treats the symptom, not the mechanism. Today, I'm going to walk you through the mechanism, and then I'm going to give you the single most powerful exercise for restoring circulation in aging legs, ranked alongside 4 supporting habits that make it even more effective. But before we dive in, I want to know something about you, because I read every single comment on these videos personally. Tell me your age and tell me this. When do your legs feel the heaviest? Is it first thing in the morning when you swing your feet out of bed? Or is it at the end of the day after you've been sitting or standing for hours? I ask because the timing of your symptoms actually tells us a lot about what's happening inside your blood vessels. And I'll be reading your answers after this video goes live. Now, let me tease you with what's coming because I don't want you to click away and miss it. The exercise at the very top of this list, the one I consider the most powerful single intervention for leg circulation in people over 60, takes less than 3 minutes a day, requires no equipment, and can be done while you're brushing your teeth or waiting for your coffee to brew. Researchers studying venous return in older adults have referred to the muscle group involved as the second heart, because of how much force it generates in pushing blood back up against gravity. Stick with me, because by the end of this video, you'll know exactly how to activate it correctly, and most people over 60 are doing it wrong or not doing it at all. Let's start at number 5, the foundation everything else builds on. Number 5, seated ankle circles and pumps. Here's the dramatic truth about sitting. Every hour you spend with your feet flat and still is an hour your calf muscles aren't contracting, which means an hour your veins are relying almost entirely on one-way valves to keep blood from pooling in your lower legs. Physical therapists who specialize in geriatric vascular rehabilitation have observed that older adults who sit for more than 6 hours a day show measurably slower venous return velocity compared to those who break up sitting every 30 minutes. Why does this matter so much more after 60 specifically? Because the valves inside your veins, tiny flaps of tissue that snap shut to prevent blood from flowing backward, lose elasticity with age, similar to how a door hinge gets a little looser over decades of use. By your 70s, some vascular researchers estimate that a meaningful percentage of these valves are functioning at reduced efficiency, which means gravity starts winning battles it used to lose. Ankle pumps and circles reactivate the calf muscle without requiring you to stand, which is perfect for anyone with joint pain, balance concerns, or recovery from surgery. To do this properly, sit with your feet flat, lift just your heels while keeping your toes on the ground. Hold for 2 seconds, then lift your toes while keeping your heels down. Follow that with 10 slow ankle circles in each direction. Aim for this every hour you're seated, especially during long car rides, flights, or afternoons in front of the television. The synergy tip here is hydration. Dehydrated blood is thicker, and sluggish blood moves slower through partially narrowed vessels. So pair this exercise with a full glass of water beforehand to give your circulatory system less resistance to work against. Number 4, heel-to-toe rocking while standing. This one surprises people because it looks almost too gentle to matter, but that's exactly the point. As we age, mitochondria, the tiny energy-producing structures inside our muscle cells, Think of them like the power plants that keep the lights on in every cell of your body, become less efficient at converting oxygen and nutrients into usable energy. Some aging research suggests that by age 70, skeletal muscle mitochondrial efficiency can decline by as much as 40% compared to muscle tissue in your 30s. That decline doesn't just affect strength, it affects how eagerly your calf muscles contract in response to movement, which directly affects how well they squeeze veins and push blood upward. Heel-to-toe rocking, done while holding onto a countertop or sturdy chair for balance, gently but repeatedly engages the calf without the joint stress of walking on hard surfaces. Do this for 2 to 3 minutes twice a day, ideally once in the morning to counteract the pooling that happens overnight and once in the late afternoon when swelling tends to peak. I had a patient, Dolores, 74, from a small town outside Sacramento, who came to me with ankles so swollen she'd stopped wearing her wedding ring on a chain around her neck because even her fingers felt puffy by evening. Within 5 weeks of incorporating heel-to-toe rocking into her routine at the kitchen sink while she did dishes, she told me her ankles finally looked like ankles again, and she started wearing sandals for the first time in 2 summers. The synergy tip for this one is timing it with meals. Doing this rocking motion about 20 minutes after eating can help counteract the blood pooling in your digestive organs, redirecting some circulatory demand back toward your legs. Before we go further, if you've made it this far, do me a favor and hit that subscribe button. And if this information is new to you, tap the like button so more people your age can find this video. I put a lot of research into every single one of these, and the algorithm only shows this to more people when you engage with it. All right, let's continue, because the next 3 items are where things get really interesting. Number 3, wall sits with calf activation. Now, I know what you're thinking. Wall sits sound like something a 20-year-old does at the gym, not something appropriate after 60. But hear me out, because this is about the isometric hold, not intensity. Isometric exercise, meaning muscle contraction without movement, has been studied for its unique ability to improve blood vessel function through what researchers call shear stress adaptation. Essentially, when blood is forced to flow through a vessel under gentle pressure, the vessel's inner lining, called the endothelium, responds by producing more nitric oxide, a molecule that helps blood vessels relax and widen. A modified wall sit, held for just 15 to 20 seconds with your heels pressing firmly into the floor, activates this response in the calf and thigh simultaneously. Why does this matter specifically for aging bodies? Because after 60, many people experience what's called anabolic resistance, a frustrating condition where your muscles become less responsive to the normal signals that build and maintain tissue, meaning you need more stimulus to get the same benefit you used to get effortlessly in your 40s. A short, controlled isometric hold provides a concentrated stimulus without the joint strain of deep squats or lunges. To do this safely, stand with your back against a wall, feet shoulder-width apart and slightly forward, slide down until your knees are bent comfortably, not deeply, and press your heels down hard as if you're trying to push the floor away. Hold, breathe normally, and release. 3 to 4 repetitions, 3 times a week, is plenty. The synergy tip here is deep breathing during the hold, slow. Controlled breaths increase oxygen delivery to working muscle tissue and prevent the blood pressure spike that can sometimes accompany isometric holds, which is especially important for anyone managing hypertension. Number 2, and this is where I really want your full attention because this is the one most doctors skip entirely. Rebounding, meaning gentle bouncing on a small trampoline, or even just rising onto your toes repeatedly with soft knees. This might sound unusual, but vascular researchers have long been fascinated by rebounding because of something called the lymphatic pump effect. Here's an analogy that makes this click for most of my patients. Think of your lymphatic system like a delivery truck route that runs parallel to your blood vessels, quietly hauling away waste products, excess fluid, and inflammatory debris from your tissues. Unlike your heart, which pumps blood automatically, your lymphatic system has no central pump. It relies entirely on muscle movement and changes in gravitational pressure to keep that truck moving. Gentle vertical bouncing creates repeated changes in pressure that researchers have found can increase lymphatic flow substantially compared to standing still, helping clear the inflammatory buildup that contributes to swelling, heaviness, and that dull, achy feeling so many people over 60 describe in their lower legs. This matters enormously for aging bodies because chronic low-grade inflammation, sometimes called inflammaging by researchers studying age-related disease, quietly damages blood vessel walls over decades, making them stiffer and less responsive. Reducing that inflammatory load through better lymphatic drainage is like clearing a traffic jam that's been slowing everything else down. To try this safely, you don't need an actual trampoline. Simply hold onto a countertop and gently rise onto your toes and lower back down in a rhythmic, bouncing-like motion for 1 to 2 minutes. If you do have access to a small rebounder, even better, but always keep one hand on a stable surface for balance. Do this in the morning to help clear overnight fluid retention. I remember a patient named Harold, 68, from just outside Phoenix, who had struggled with what he called sausage ankles every single evening for years. He started gentle rebounding for 90 seconds each morning, and within about 6 weeks, his wife noticed his ankle definition had returned enough that his shoes weren't leaving deep red marks by dinner time. The synergy tip here is compression-wearing light compression socks during and after rebounding can amplify the lymphatic and venous benefits by giving your tissues external support while the internal pump is doing its work. And now number 1, the exercise I promised you at the beginning of this video. The one researchers studying venous return have nicknamed activity for the second heart. Calf raises done correctly and consistently are, in my professional opinion, the single most powerful exercise for circulation in the legs after 60. And here's exactly why. Your calf muscle, specifically the gastrocnemius and soleus muscles at the back of your lower leg, functions almost like an auxiliary pump for your entire venous system. When it contracts, it squeezes the deep veins running through it, forcing blood upward against gravity toward your heart. And when it relaxes, one-way valves prevent that blood from sliding back down. Vascular physiology researchers have measured that a properly functioning calf muscle pump can move a striking percentage of total venous return from the lower body. Some estimates suggest the calf pump handles the majority of blood volume returned from the legs during upright activity. Think of your calf muscle like the compressor on a submersible pump at the bottom of a well, tirelessly pushing water upward through a pipe. When that compressor weakens, water backs up. When your calf muscle weakens or stops contracting frequently enough, blood backs up too, pooling in your lower legs and feet, causing the swelling, heaviness, discoloration, and aching that so many people over 60 simply accept as normal aging. Here's why this hits aging bodies particularly hard. After age 60, many people naturally reduce daily walking distance due to joint discomfort, balance concerns, or simply spending more time at home, and this reduction directly weakens the calf pump through disuse, creating a frustrating cycle where poor circulation causes discomfort. Discomfort reduces movement, and reduced movement worsens circulation further. Combine that with the natural stiffening of vein valves and declining mitochondrial efficiency I mentioned earlier, and you have a perfect storm sitting quietly in your lower legs. Calf raises interrupt that cycle directly by voluntarily activating the exact muscle responsible for pumping blood upward without requiring long walks, joint-stressing impact, or expensive equipment. Here's how to do them properly, because form matters enormously here. Stand near a wall, countertop, or sturdy chair for balance support. Keep your feet hip-width apart, weight evenly distributed. Slowly rise up onto the balls of your feet, lifting your heels as high as comfortably possible. Hold for a full 2 seconds at the top, then lower slowly, taking about 3 seconds to control the descent rather than dropping quickly. That slow, controlled lowering phase, sometimes called the eccentric portion of the movement, is where much of the muscular and circulatory benefit actually occurs, so resist the urge to rush it. Aim for 2 sets of 15 repetitions, ideally once in the morning to counteract overnight pooling and once in the early evening to clear fluid that's accumulated throughout the day. If standing calf raises feel too challenging initially, seated calf raises using a small weight or resistance band across your knees provide a gentler entry point with nearly identical circulatory benefits. For optimal results, most vascular rehabilitation specialists suggest performing this daily, though even 3 to 4 times weekly produces measurable improvement in reported leg heaviness and swelling within 4 to 6 weeks. Let me tell you about Marjorie, 71, from a quiet neighborhood near Tulsa. When she first came to my clinic, she described her legs as feeling like wearing wet, sand-filled boots every single afternoon. She'd essentially stopped gardening, something she'd loved for 40 years, because standing for more than 15 minutes left her legs throbbing. I taught her the calf raise routine exactly as I've described it to you, twice daily, and asked her to be patient and consistent. 6 weeks later, she called my office, not for an appointment, but just to tell my staff that she'd spent an entire Saturday morning back in her garden, kneeling and standing repeatedly without that familiar heaviness setting in. She cried on the phone. That's the kind of transformation we're talking about here, and it came from an exercise that costs nothing and takes about 3 minutes a day. The synergy tip for calf raises, and this is important, is pairing them with elevation immediately afterward. After completing your set of calf raises, lie down or recline with your legs elevated above heart level for 5 to 10 minutes. This combination does something remarkable. The calf raises actively pump blood and lymphatic fluid out of your lower legs, and the subsequent elevation uses gravity to prevent it from immediately pooling back down, essentially locking in the benefit of the exercise. Some patients also find that doing calf raises after a warm shower enhances the effect further, since mild heat causes blood vessels to dilate slightly, making the pumping action even more efficient. Now, before you go, I want to be honest with you about something. None of these 5 exercises are a replacement for proper medical evaluation if you're experiencing significant swelling, skin discoloration, wounds that won't heal, or sudden pain in one leg, all of which warrant a visit to your doctor promptly. What I've shared with you today is meant to address the everyday circulation sluggishness that comes with normal aging, the kind that makes your legs feel heavy, tired, and swollen without any serious underlying disease. All of the research I've referenced throughout this video is linked in the description below, so you can read further and share it with your own physician if you'd like their input. I want to leave you with something that I think about every single day in my practice. Independence, real independence in your 70s, 80s, and beyond, doesn't come from a single dramatic decision. It comes from small, consistent choices, made quietly, day after day, that keep your body capable of doing the things that matter to you. Being able to garden without your legs aching. Being able to walk your grandchild to the park without needing to stop and rest every block. Being able to stand at the stove and cook a full meal without that heavy, swollen feeling creeping in by the time dinner's ready. These aren't small things. They're the fabric of a life well lived, and your circulatory system, quietly, invisibly, is either supporting that life or working against it every single day. The beautiful truth is that it is never, ever too late to strengthen that system. Your body, remarkably, retains the ability to adapt and improve well into your 80s and 90s if you simply give it the right consistent signal to do so. So start today. Not next Monday, not after the holidays, today. Do one set of calf raises right now if you're able, holding onto the back of a chair for balance. Feel your calf muscles engage. That's your second heart, waking up. If this video helped you, please subscribe to this channel, because I release new videos like this every single week covering the questions my patients ask me most often. And leave a comment below telling me which of these 5 exercises you're going to start with today and how your legs have been feeling lately. I read every single comment, and I truly do respond to as many as I can. Take care of those legs. They've carried you this far, and with a little help, they'll carry you a lot further.